The number of heroin-related deaths in the United States increased nearly 300% since 2002, according to a new report from the Centers for Disease Control. The report also finds a few groups of people with historically low use of heroin are starting to use the drug at a high rate. News 8's Kyle Dimke joins us now with more.
Well, Lisa, the CDC report shows that some of the biggest increases in heroin use has been in women and those with private insurance and higher incomes. But experts say heroin does not discriminate because there is an increasing number of heroin users in nearly all walks of life.
Well, heroin's the mother of all opiates.
Dr. David Onsrud is the medical director of the Mayo Clinic's Addiction Services. He says here in the La Crosse area, heroin is really becoming a problem.
For the last 3 to 4 years, I've seen more heroin than I've ever seen in this area.
But La Crosse is not alone. All across the U.S., heroin is a growing problem. A recent report from the CDC shows that from 2002 through 2013, the number of heroin-related deaths increased about 280%.
Heroin became much more available. It's cheaper. Unfortunately, you don't know what you're getting. So the overdose and the deaths is because they're getting an unknown product.
And the number of women using heroin has doubled in that same time.
I suspect it's been a more gradual thing because more women have been exposed to pain medication for various problems. They've developed the opiate addiction, if you will, and then have moved on to heroin.
In La Crosse County, officials noticed heroin as a problem several years ago and decided to do something about it. So they formed the La Crosse County Heroin Task Force.
Probably in as early as 2010, 2011, we started noticing that heroin and opioid use had increased, especially the overdose deaths. I think we've made some inroads with decreasing both the availability of heroin, but still remains a problem.
Task Force Coordinator Al Bliss says to coordinate this heroin problem, communities need to form some sort of program similar to the Heroin Task Force to get like-minded people working on a similar goal.
We need to educate the community so it's offering help, treatment, prevention, a lot of awareness. There's a lot of things that need to go into a community's toolkit to address the comprehensive problem of drug abuse.
And Dr. Onsrud of the Mayo Clinic says people with a drinking problem are at a much higher risk of developing a problem with pain pills and or heroin. And he says people that smoke have a 3 to 5 times increased risk of abusing their pain pills.
All right, thank you, Kyle. The report from the CDC says 96% of people who reported using heroin also reported using it at least one other drug in the past year. 61% of those people reported using at least 3 drugs in the last year.